Hello viewers, this is Smita Kumar and you're watching Medicircle. Today on our CIOs and IT Manager series, we have Samrat Bhattacharya with us. Samrat is the Senior IT Manager at Peerless Hospitex Hospital and Research Center, Kolkata. He has 10 years of experience in healthcare industry. Hi and welcome to Medicircle, Samrat.
Hello, hi.
So, Samrat, it is always good to talk to people who are basically always behind the curtain because we always talk about digitalization in healthcare, and it is you people who are actually driving it. That they are the front runners. So, how does it feel exactly to be into the digital section of healthcare and making so much healthcare accessible and more available to patients out there?
Yeah. It's very challenging, first of all, because in this industry, healthcare industry, there are IT is very. I mean to say they think is there any problem? I mean to say any options for IT, but there are so many things are there. So to improve the healthcare system, to healthcare patient service, there are so many things. Indoor service, all things are depends on the IT. So IT is very much key factor in the industry.
And what
So
message?
that's a very challenging thing.
Very,
And
very true.
here,
Because
I mean,
to implement IT, to implement HIS systems, to implement any new technology is little bit challenging, especially when there is a very critical
yeah,
care sectors
yeah,
where the patient outcomes are extremely important. We need to be very, very careful with the outcomes which is coming from the software.
actually,
So,
yeah.
what lessons
And
you
the
have
patient
learned?
security also.
Yes, data security also,
Sorry.
because today data is the oil. You have to be extremely careful about how the data is being transported from one system to another.
Exactly.
So tell us some lessons that you have learned in your journey, which you would like to share with the people out there in the healthcare IT space.
Yeah, I'm from IT background. My education is on my post graduation on computer applications. But thing is that whatever I have learned from my institute, from my college, from my university, but when I joined healthcare, the total perspective is changed because the IT is mainly we have done our all projects, all things on some data of commercial data, but here, when we come in healthcare industry or hospital industry, the data is medical data. The medical data is very much interesting, and there, the patient, there is a bonding between the patient data and the medical data. So there's so much medical logic, medical protocols are there. So these are very interesting to implement those kind of things in our HIS system. So this is the main thing I have learned from my past years.
And what are the possibilities and growth lay ahead in the sector of healthcare IT? Because I think post COVID,
Yeah,
we are embracing technology with open hands. So what
exactly.
will you expect?
I'm, yeah, I'm coming on that point. After COVID, the IT has totally covered up the healthcare because um, every little bit thing is done now in no contact, not only IT, because doctors are seeing the patient through IT, through the, I mean to say, telemedicines and these kind of things. So these all are implemented by IT guys. So these are very challenging. And from the COVID, there are so many things are coming digitally because the pathological reports and all the radiological reports, all the testimonials of the patient related things, these all digitalized. So these are very key factors. I mean to say, these are very huge scope of the IT person if they can plan to join healthcare, yeah, IT, I mean to say hospital industry. So there are lots of possibilities are opened here.
So, as you have got a decade experience in the healthcare IT segment, any advice you would like to give to the new budding people who are trying to enter into the IT sector?
Yeah, actually, I just say one thing, that always listen the pulse of the healthcare industry, because the thing is that it is very different from the other industries. You can't take any drastic decisions. You can't take any kind of testing, life testing things here, because all are very live data and all are very sensitive data, because patient data is very sensitive. So this is the main thing. Otherwise, it's okay, and it's very challenging. Come the all IT guys in healthcare, it is very much interesting.
So thank you so much,
Sorry.
Samrat, for joining us today for this healthcare CIO and IT manager series. We wish you all the best of luck for your all the future endeavors, and hope you digitalize the HIS systems and all other systems which you want to implement. Because at the end of the day, patient is at the center of this continuum of care. And the more the systems are digitalized, the more ease and comfort is passed on to the patient. So thank you once again for joining, and we wish
Thank you very much. It's nice to talk to you. Thank you very much.
Thank you.